Hey everyone, welcome back to all my listeners. This is episode 4 in season 18. Today is Wednesday, June 24th, 2026. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys. Well, I hope the fathers and father figures out there had a wonderful Father's Day this past Sunday, or I hope you had an entire weekend of fun, golfing or fishing with your kids, letting the young ones make you crooked pancakes, orange juice for breakfast, whatever their little hearts desired. And then with those adult kids like myself, far away from my father, I hope you got phone calls and heartwarming cards in the mail as well. All right, you guys. Well, let's get into today's episode. Today's going to be a heftier episode. As we know, it is the last Wednesday of the month. And you know, it's going to feature my Newsworthy fraud, waste, and abuse highlights for the month of June 2026. And of course, I'll go ahead and spotlight some of those from the month's criminal and civil enforcement cases that I find newsworthy. And in my Trusty tip, I'm going to be focusing on documentation requirements for non-invasive vascular studies. And in Spark, I go ahead and round out today's episode with a remarkable quote by Jack Canfield. Let's get into it. The month of June saw 32 cases of fraud, waste, and abuse as of the recording of this episode. Let's go ahead and check out some of those cases that I want to spotlight. June saw laboratory executives, marketers, and physicians to pay over $2 million to settle allegations of illegal kickbacks to doctors. A former laboratory CEO from New York and a former laboratory sales executive from Pinehurst, North Carolina, have agreed to pay $1.2 million to resolve False Claims Act litigation with the United States alleging illegal payments to doctors for laboratory referrals in violation of the anti-kickback statute. One doctor of Missouri City, Texas, and 6 marketers, all from Magnolia, Texas, have agreed to pay an additional $859,055 to settle the United States laboratory kickback allegations against them in the case. With these settlements, the Department of Justice has secured over $61 million in Civil False Claims Act settlements since 2019 for kickbacks to healthcare providers disguised as managed service organization or MSO investment distributions, including recoveries from over 50 physicians. The anti-kickback statute prohibits offering, paying, soliciting, or receiving remuneration to induce referrals of items or services covered by Medicare, Medicaid, and other federally funded healthcare programs. It seeks to ensure that medical providers' judgments are not compromised by improper financial incentives and are instead based on the best interests of their patients. The former female CEO of Boston Heart Diagnostics Corporation, a laboratory in Framingham, Massachusetts, agreed to pay $600,000 to resolve allegations that she caused false claims for laboratory testing to Medicare, Medicaid, and TRICARE from the years 2015 through 2017. Likewise, the former VP of sales at Boston Heart also agreed to pay $600,000 to resolve allegations that he caused false claims for laboratory testing to Medicare, Medicaid, and TRICARE from the years 2015 through 2017. Both the former CEO and former VP of sales allegedly agreed to a kickback scheme in which marketers, including Boston Heart's own employees, offered and paid doctors kickbacks disguised as MSO distributions to induce the doctors' referrals to Texas hospitals for laboratory testing performed by Boston Heart, including medically unnecessary testing. The pair allegedly knew that the marketers using MSOs were recruiting doctors to order testing performed by Boston Heart for a hospital in Texas and were given a quote-unquote strong recommendation to quote-unquote reel this in and quote-unquote stand down on all hospitals, particularly in Texas. Nevertheless, the former CEO allegedly approved and the former VP of sales allegedly implemented an expansion of the Texas hospital arrangement to another hospital to continue working with many of the same marketers. In addition, the settlements announced resolve the United States allegations in the lawsuit that the physician solicited and received kickbacks in violation of the anti-kickback statute from laboratory marketers, purported MSOs, in return for laboratory testing referrals. This physician agreed to pay $309,055 to resolve allegations that from November 2015 through November 2017, he received thousands of dollars in payments from two purported MSOs, Ascend MSO of Texas LLC and Indus MG LLC, in return for ordering laboratory tests from Little River Healthcare, a critical access hospital in Rockdale, Texas, and True Health Diagnostics LLC, a clinical laboratory in Frisco, Texas. Lastly, the six marketers and their associated entities agreed to pay a total of $550,000 to resolve the United States allegations in the civil litigation that they paid kickbacks disguised as MSO payments to doctors to induce the doctors' laboratory testing referrals. The claims resolved by the settlements here are allegations only, and there has been no determination of civil liability. June saw Sunshine Care Partners and Rusty McMurray were excluded for 10 years. Effective June 3, 2026, the OIG excluded Sunshine Care Partners, Inc. and its owner, Rusty McMurray, of Oklahoma, from participation in all federal healthcare programs for periods of 10 years under 42 USC 1320A through 7B7. The exclusions were imposed based on Sunshine Care's submission of claims for complex chronic care management services for beneficiaries who never received the services. Instead, Sunshine Care's employees completed administrative services for the healthcare facilities with which it contracted, including taking the temperature of everyone who entered the facility, sanitizing and cleaning the front desk areas, and organizing paperwork. June saw AG's office secures up to $770,000 in settlements with former Whittinsville Applied Behavioral Analysis provider and its co-owners for submitting false claims to Mass Health. The Massachusetts Attorney General's Office, the AGO, announced that it has reached settlements with Flexible Fundamentals, Inc., a former Whittinsville-based Applied Behavioral Analysis provider, an ABA provider, and its co-owners. The settlement agreements resolve allegations that, under the pair's ownership, the company fraudulently billed Mass Health, the state Medicaid program, through its managed care entities, or MCEs, for ABA services that were never provided and or not properly documented, and for failing to provide adequate supervision of its paraprofessional behavioral technicians. Under the terms of the agreements, Flexible Fundamentals and its co-owners will pay up to $778,703 to the Commonwealth of Massachusetts. The settlement also requires one owner and her new company, Pragmatic Minds LLC, and the other and her new company, Social Perspectives for Everyone LLC, to implement compliance and monitoring programs for 3 years to ensure compliance with ABA requirements and provide additional training to staff. The independent compliance monitors will conduct annual on-site audits to verify each company's compliance with state and federal laws. ABA is a treatment principally designed for children with autism spectrum disorder. ABA services focus on the analysis, design, implementation, and evaluation of social and other environmental modifications to produce meaningful changes in behavior. Many of these services are delivered by paraprofessional staff, often referred to as behavioral technicians. But Mass Health and its MCEs require that all behavioral technicians be supervised by licensed applied behavioral analysts. The AGO alleges that Flexible Fundamentals billed Mass Health for more hours of service than Flexible Fundamentals had actually provided to members. The AGO alleges that the company and its owners submitted claims to MCEs for ABA services provided by paraprofessional behavioral technicians who were not supervised by licensed applied behavioral analysts as required. June saw Attorney General James secures $36.5 million from CVS for defrauding Medicaid. New York Attorney General Letitia James joined a bipartisan coalition of 36 other attorneys general and the United States Department of Justice in securing $36.5 million from CVS Pharmacy for fraudulently overbilling Medicaid for insulin prescriptions. From 2010 through 2020, CVS knowingly dispensed more insulin to customers than they needed, while maintaining that they were reporting the correct amount of insulin in their prescriptions. These fraudulent claims allowed the company to rake in millions in extra reimbursements from Medicaid for insulin distribution. Under a settlement with Attorney General James and the coalition, CVS will pay more than $25 million to state Medicaid programs across the country, including $2.25 million to the state of New York. Quote, when big companies defraud Medicaid, hard-working New Yorkers pay the price, said Attorney General James. She goes on and says, quote, our state's Medicaid funds should support health care for those in need, not unjustly boost the profits of big corporations like CVS. My office is focused on stopping fraud in all its forms, and I will continue to root out corporate corruption on behalf of New Yorkers, end quote. Insulin pens are a set dose of insulin in a syringe contained inside a plastic shell, and they are a common way for diabetic patients to give themselves the insulin they need. Patients need a prescription for these pens and receive a supply from their pharmacy that will last them a certain amount of time, often 30 or 90 days, along with instructions on how to administer the correct dose at the right frequency. Attorney General James and the coalition's investigation found that CVS dispensed more insulin to Medicaid recipients than their prescriptions specified and refilled insulin pen prescriptions well before they were needed. This allowed CVS to overbill Medicaid millions of dollars for more insulin than it should have been dispensing. To cover up their fraud, CVS falsely underreported the amount of time that the supply of insulin would last and failed to comply with certain rules used to calculate refill dates. As a result of CVS's false claims, some Medicaid recipients accumulated large quantities of unused insulin, which was both wasteful and potentially dangerous, as insulin can expire. As a result of the settlement, CVS will pay $36.5 million to the states and federal government, including over $25 million for Medicaid programs in the participating states and over $2 million for the state of New York. Joining Attorney General James in securing the settlement are the attorneys general of Arizona, California, Colorado, Connecticut, Delaware, Florida, Hawaii, Illinois, Indiana, Iowa, Kansas, Maine, Maryland, Massachusetts, Michigan, Minnesota, Missouri, Montana, Nebraska, Nevada, New Hampshire, New Jersey, North Dakota, Ohio, Oregon, Pennsylvania, Rhode Island, Tennessee, Utah, Vermont, Washington, West Virginia, Wisconsin, and the District of Columbia. June saw San Francisco company agrees to pay over $3 million to resolve allegations that they submitted false claims for healthcare payments. San Francisco-based Circle Medical Care of California, Circle Medical Technologies, Inc., and their chief medical officer and medical director have agreed to pay a total of $3,325,000 to the United States and the state of California to settle allegations that they knowingly submitted claims for payments to federal healthcare programs and California commercial insurers for services by providers who did not actually provide or supervise those services in violation of the Federal False Claims Act and corresponding state statute. Circle operates an online telehealth platform through which it offers mental health treatment and primary care medical services through contract providers, including nurse practitioners and physician assistants located throughout the country. Circle submits claims for payment to federally funded health programs, including Medicare, Medicaid, and TRICARE, and to California commercial insurers. The United States and California allege that Circle submitted claims for payment to those programs and insurers for these services and received a reimbursement between January 1st of 2018 and May 31st of 2025, despite knowingly identifying the name, and NPI, or the National Provider Identifier number of rendering providers who did not actually provide or supervise the services rendered and failed to properly supervise the nurse practitioners and physician assistants who rendered medical services to its patients during this period. Under the settlement agreement, Circle will pay $475,000 to the United States and $2,850,000 to the state of California. The settlement resolves claims brought under the QTAM, or whistleblower provisions of the False Claims Act. Under those provisions, a private party can file an action on behalf of the United States and receive a portion of any recovery. The relator in this case will receive $80,750 from the United States and $997,500 from the state of California. The claims resolved by the settlement here are allegations only, and there has been no determination of liability. June saw CHI St. Vincent Medical Group Hot Springs agree to pay $160,000 for allegedly violating the civil monetary penalties law by submitting false claims for facet joint injections. On June 11, 2026, CHI St. Vincent Medical Group of Hot Springs, Arkansas, entered into a $167,828.06 settlement agreement with the OIG. The settlement agreement resolves allegations that St. Vincent submitted claims to Medicare for facet joint injections that were false, fraudulent, or medically unnecessary because the rendering provider did not perform diagnostic facet joint injections prior to rendering therapeutic facet joint injections. June saw Journey to Hope Health and Healing and former CEO agree to pay $10.2 million to resolve false claims allegations. Journey to Hope Health and Healing and its former CEO have agreed to pay $10.2 million to resolve allegations that the opioid treatment provider submitted false claims to the Rhode Island Medicaid program and Medicare for substance use disorder treatment services that were not provided. Journey, when owned and led by its former CEO, operated outpatient treatment facilities in Rhode Island that provided substance use disorder treatment services, including methadone-assisted treatment and mental health care services. The settlement resolves allegations made by the state of Rhode Island and the United States in a complaint in intervention that between January of 2015 through July of 2021, Journey and its management knowingly submitted false claims to the Rhode Island Medicaid program for millions of dollars. In April of 2023, the United States and the state of Rhode Island filed a complaint in intervention under the Federal and State False Claims Acts and alleged that Journey failed to provide required treatment plans and adequate counseling services to certain patients receiving methadone treatment. The complaint also alleged that Journey maintained patient caseloads at a volume so high that it was physically impossible for counselors to provide required counseling services. The complaint further alleged that Journey and its management knowingly falsified documents by altering and backdating records to make it appear to accreditation officials and Rhode Island Medicaid auditors that they were complying with the accreditation requirements necessary to bill Rhode Island Medicaid. Under the settlement agreement, Journey and its CEO will pay $10.2 million to the United States and the state of Rhode Island to resolve their alleged liability under the federal and state False Claims Acts. The settlement includes the resolution of claims brought under the QTAM or whistleblower provisions of the False Claims Act by two former Journey employees. Under those provisions, private parties may file civil actions on behalf of the government and receive a portion of any recovery. Under the settlement agreement, the whistleblowers will receive approximately $2 million of the settlement proceeds. And now it's time for my best practice tips in Trusty Tip. I wanted to go over a recent update that my local MAC put out on their webpage a few days ago. Remember, NGS, National Government Services, is now operating as WellPoint Federal. I went over the new partnership as soon as it became effective back in April 2026. So I go over this exact type of education with my physicians when they include non-invasive vascular studies or duplex scans in their service lines for their specific patient populations. So this Trusty Tip is specific for the states of Illinois, Minnesota, Wisconsin, Connecticut, New York, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont. Quote, the WellPoint Federal LCD L33627 outlines Medicare coverage criteria for non-invasive vascular studies, including duplex ultrasound procedures. Proper documentation and medical necessity are essential for reimbursement and compliance. Complying with WellPoint Federal LCD L33627 requires clear, detailed documentation that demonstrates medical necessity, clinical specificity, and accurate coding. Explicit symptom descriptions, inclusion of abnormal ABI or ankle brachial index results, and a focus of how vascular disease affects the patient's life are essential to support coverage and reduce denials. And they go on and talk about specific CPT codes. Those are our current procedural terminology codes specific to this LCD. And those are our CPT codes 93925 and 93926. Now, 93925 is specific for our lower extremity arterial duplex complete bilateral study. And our CPT code 93926 is specific for our lower extremity arterial duplex unilateral limited study, end quote. So another tip from me, be mindful that there are other codes, right, that do not fall into this specific LCD L33627, right? Because those duplex scans, for example, are for upper extremities. And those two codes I just listed a moment ago are only dealing with the lower extremities, right? So when you're selecting codes, make sure that you are choosing correctly based on the documentation. Now, the tip goes on and says, quote, medical necessity. Vascular studies must be ordered by a treating provider and supported by clinical indications that demonstrate medical necessity. The results must have the potential to influence patient management, such as determining the need for intervention, guiding postoperative surveillance, or assessing disease progression. Now, WellPoint Federal goes on and talks about the key criteria that are involved in this LCD. Clear symptoms and signs. For example, those include claudication, diminished pulses, bruit, or neurological deficits. Detailed documentation of symptoms, including their severity and how they interfere with lifestyle or occupation. Another key criteria includes ABA values that must be documented and should reflect abnormal findings when applicable. If the ABA is normal and or the physician determines it's not necessary, the physician must thoroughly document the reason that you're moving forward with the duplex scans. When the ABA cannot be performed or the result is unobtainable, documentation should specify the clinical circumstances that prevented measurement. Examples include severe arterial calcification resulting in non-compressible vessels, limb amputation, wounds precluding cuff placement, etc. Now, WellPoint Federal goes on and says that the test must not be routine or duplicative of another diagnostic procedure. They move on and talk about documentation requirements. The LCD covers accurate, detailed records are crucial to support the medical necessity of non-invasive vascular studies. The WellPoint Federal LCD emphasizes the following elements. Number one, the physician order must be present in those records, right, with a clear clinical indication. Number two, specific symptoms and their impact on daily activities or work performance must be documented. Number three, those ABI results, right, those ankle brachial index results that support the presence of arterial disease when applicable. Number four, the study details, the vessels that have been examined, the laterality, the extent of disease, and other findings. Number five, documentation should include comparison with prior exams when available. Number six, documentation should include interpretation that connects findings to patient management decisions. And finally, number seven, credentials of the technologist and interpreting physician are also required in documentation. Now, WellPoint Federal goes on and talks about coding guidelines, right, for CPT code 93925. Use only when both lower extremities are fully examined. And then for our CPT code 93926, use for unilateral or limited lower extremity studies. I've seen that mistake time and time again as I'm auditing these types of services. Now, avoid billing for both physiologic and duplex studies on the same limb unless clinically justified. Bill only interpretable and completed studies. Now, they go on and talk about frequency and follow-up. Repeat studies are covered only if new or worsening symptoms arise. Post-intervention surveillance should use limited or unilateral codes unless there is bilateral indication. Routine or excessive repetition without clinical justification may result in denials. There are also common denial causes: lack of ABI documentation or missing abnormal values, vague or incomplete symptom descriptions, overcoding, for example, billing bilateral when only unilateral was performed, duplicative studies performed without clear rationale, missing the credential documentation for performing or interpreting personnel. I've seen that time and time again. And finally, they conclude with their best practice recommendations. Document specific symptoms and functional impact, for example, severity, lifestyle, and occupational interference. Always include those ABI results when applicable and note any abnormalities. Match your CPT code precisely to the extent of the study performed. Ensure each test is clinically justified and not repetitive. Maintain strong documentation links between the test results and treatment decisions, end quote. I think this latest reminder from NGS WellPoint Federal is simply outstanding. I know I'm going to use it in addition to the many checklists I create for my physicians across the country as well. Including this level of detailed documentation in patient records is critical if practices are ever audited by the payer. This level of documentation will stand up to payer scrutiny because it meets the medical necessity requirements the payer is demanding. And finally, in this week's inspiring quote in Spark, I continue season 18's focus on fear. So this week's Spark is from Jack Canfield. Everything you want is on the other side of fear. So very true, right? I love this quote on fear. It inspires to push through fear. It encourages us to get out there and take a chance. There is no one else who can accomplish what you want out of your life other than you. Believe in yourself. I know I do. I'm happy Jack Canfield's spark burns brightly and can still inspire so very many. All right, you guys. Well, that wraps up today's episode. So I really hope you guys got a lot out of both of those segments in today's Newsworthy and today's Trusty Tip. So I can't believe the month of June is coming to a very swift end here in just a few days. My birthday is just a few days away as well. So there's lots for me to take stock in and be grateful for. I know my audience here is simply incredible. Week after week, year after year, you've been tuning in and you've been encouraging me to keep going. So thank you. All right, you guys. Well, I wish you all an amazing and very, very happy week ahead. Thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.